I have a personal passion and commitment to really looking at how do we improve health and wellbeing of communities. I'm really excited by today and to see what we can do with so many friendly faces in the audience around how we can come together, learn from other thought leaders and innovators around opportunities to improve primary care and better support the people in our communities.
We all know that health is determined by many, many factors that you can't just see through a medical lens. So what about the broader social determinants of health? What about the role that the community can play? So it's in that light that we drew up a vision for our population moving forward. And that is a community that start their life's journey well, that remains well connected to themselves, their own community, and to the healthcare providers that support them throughout that journey. We have enough funding to maybe fill some of the gaps in health equity, but the opportunity really lies in being a catalyst for the community to support itself. And how can we better integrate our systems and services? We need to consider new models of care, things like social prescribing. So we're about possibility today. We're not about solutions that will come. You will see a QR code in front of you, and at any stage throughout the day, early or late, you go, actually, I'd like to be part of this journey. Then scan the QR code, give us your details, and we'll be in touch. Because today we're going to hear a lot of ideas about what could be possible moving forward, but we'd like to involve our whole community moving forward. So it is a journey. The destination is not clear. That makes us all at the PHN feel a little bit nervous because uncertainty is sometimes not a good thing. But the opportunity today is to hear from each other, to hear from our speakers and understand what is possible. And we'd love you to sign up with us for that journey.
This is going to make you uncomfortable, and I want to make you uncomfortable because we are victims of your comfort.
The powerful testimony that you hear is a story that you hear so many different times when you talk to people in the community falling through the gaps in care and are unable to have that voice heard.
So social prescribing is really about recognizing that health is a lot more than health, that a person's health is actually shaped by social, economic, and environmental factors. And social prescribing is really an attempt to try to integrate those factors into the healthcare system.
And it's sort of horrifying to me that we have 250 families living in motels with over 40% of children under 5. And if we went across Australia, that would be thousands.
It does not matter if we can extend lifespans if we cannot extend health spans to an equal extent.
And we know, based on the Treasury International Report data, that by 2062, the cost of healthcare is going to triple.
All of your services together should be working like a beautiful orchestra. Orchestras aren't made of 70 violins. They're made of all these different instruments, all playing a special part to come together and build this beautiful music that transforms you and brings life and beauty and connection. And that's what you should all be doing together.
So the Alice model of care came up with this triangle of an idea: a health kiosk, a connected communities approach, and then for those older people who are not doing so well, the idea of a link worker approach, a bit like social prescribing, so that actually we can support people with their health and well-being needs.
So the value proposition is really clear. It's much better to live a good life and to have the basic essentials in place than to actually have a long life that's not good.
I think a turning point for me was seeing a man change his colostomy bag in Boundary Street in West End and thinking, oh my God, like he didn't have anything that he needed. We had to run into the chemist because the only bag he had broke.
A 51% reduction in hospitalization with this value-based model of primary healthcare. 51. So we are talking about billions of dollars that can be used to what we discussed this morning.
Imagine a world where you can work out right down to a postcode what's happening with people. Well, guess what? We can. We have a roadmap. Now we need the collaborative power and the tools and the data to make a difference.
So what you've got to do is look around to what you have and try to find a pathway. I bet you most of the integrated care programs that have been sustainable and really made a difference have done it despite the system, not because of it, okay? So that's the point. Everybody here has the agency to be able to determine the futures that's put in front of them, no matter how difficult it is. And that's the message. Everybody in this room can make a difference today on the communities in which they serve, and nothing should get in the way of that.
Nothing will happen if we don't work together. We just don't quite know where we're heading, but that's kind of cool because you're not locked into a place that you have to get to because someone told you to get there. And furthermore, the local health district has some representatives here today. There's a lot of hugely well-meaning people doing incredibly good jobs, but how do we work better? To your point, I find myself uncomfortable. I find myself a little bit vulnerable in that uncomfortableness, but I know that there's a team that are really committed to saying, well, where do we start? What can we change? And let's prove it up.
There's so much untapped social capital in the Northern Sydney region. There are so many people in their retired years who are looking to give back. There are so many young people who are looking to connect. If we can find more ways for people to participate in community life, participate in their health, then I think we'll really see a change.
We're really excited by the prospect of being able to collaborate more closely and see huge benefit and opportunity in being able to do that.
I think one idea that has excited me today is to be uncomfortable and think about past mistakes and be vulnerable to talk about them and revisit them so that we can learn and grow.
I've had a number of people come up to me and say it's great to have that event because really we're talking about ideas. What things can we do as a community to support people in their healthcare journey? The key to having this event is to think about what is possible, what can we provide to the community that can support their healthcare needs. So a very exciting event for us.